Urinary incontinence is a prevalent and distressing condition that affects millions of individuals worldwide. It refers to the involuntary loss of urine, causing social, emotional, and physical challenges for those affected. Understanding the causes, types, and management options for urinary incontinence is crucial for individuals, healthcare professionals, and society at large. This video aims to provide a comprehensive overview of urinary incontinence, including its types, causes, diagnostic approaches, and effective management strategies. Types of urinary incontinence. Urinary incontinence can be categorized into several types, each with its specific characteristics and underlying causes. The most common types include stress incontinence. Stress incontinence occurs when urine leakage is triggered by physical activities that increase intra-abdominal pressure, such as coughing, sneezing, laughing, or exercising. It is commonly associated with weakened pelvic floor muscles and can affect both men and women, although it is more prevalent among women. Urge incontinence. Urge incontinence, also known as overactive bladder, is characterized by a sudden, intense urge to urinate, followed by involuntary urine loss. It is often caused by an overactive detrusor muscle in the bladder, leading to frequent and urgent urination. Neurological conditions, such as Parkinson's disease or multiple sclerosis, can contribute to urge incontinence. Overflow incontinence. Overflow incontinence occurs when the bladder does not empty completely during urination, leading to a constant dribbling of urine. It is commonly caused by bladder outlet obstruction or weakened bladder muscles, which result in the inability to fully empty the bladder. Functional incontinence. Functional incontinence refers to the inability to reach the toilet in time due to physical or cognitive limitations. Individuals with conditions such as arthritis, dementia, or mobility impairments may experience functional incontinence. It is important to differentiate this type from other forms of urinary incontinence to provide appropriate management. Causes and risk factors. Urinary incontinence can arise from various factors, and understanding the underlying causes is essential for effective management. Common causes and risk factors include weak pelvic floor muscles. Weakened pelvic floor muscles, often resulting from pregnancy, childbirth, or aging, can contribute to stress incontinence in women. Hormonal changes. Hormonal fluctuations, particularly during menopause, can contribute to urinary incontinence in women. The decline in estrogen levels can lead to thinning of the urethral lining and weakened bladder support, increasing the risk of incontinence. Neurological disorders. Conditions affecting the nervous system, such as multiple sclerosis, Parkinson's disease, or spinal cord injuries, can disrupt the normal functioning of the bladder and lead to urinary incontinence. Urinary tract infections, UTIs. UTIs can cause temporary urinary incontinence, primarily in older adults. Infections in the urinary tract can irritate the bladder, resulting in a sudden and uncontrollable urge to urinate. Other contributing factors: obesity, certain medications, such as diuretics or sedatives, smoking, chronic constipation, and certain dietary factors, such as caffeine or alcohol, can exacerbate urinary incontinence or increase the risk of developing the condition. Diagnosis and evaluation. Accurate diagnosis and evaluation are crucial steps in understanding and managing urinary incontinence. The diagnostic process may involve the following: medical history and physical examination. The healthcare provider will gather a comprehensive medical history, including details of symptoms, patterns of urine leakage, and potential contributing factors. A physical examination may be conducted to assess pelvic floor strength, neurological function, and signs of underlying conditions. Urinalysis and post-void residual measurement. Urinalysis helps identify potential infections or abnormalities in the urine. Measuring post-void residual volume assesses how well the bladder empties after urination and helps determine if incomplete emptying contributes to urinary incontinence. Bladder diary. Keeping a bladder diary, which records fluid intake, voiding frequency, and episodes of incontinence, provides valuable information about patterns and triggers of urinary incontinence. Specialized tests. Additional tests, such as urodynamic studies, cystoscopy, or imaging scans, may be performed to assess bladder function, rule out structural abnormalities, or evaluate the presence of underlying conditions. Management and treatment options. Management of urinary incontinence depends on the type, severity, and underlying causes. The following are common strategies used in the management of urinary incontinence. Lifestyle modifications. Lifestyle changes may include weight management, fluid management, reducing caffeine and alcohol intake, timed voiding schedules, and pelvic floor exercises, Kegel exercises, to strengthen the muscles supporting the bladder. Behavioral therapies. Behavioral therapies, such as bladder training, urge suppression techniques, and biofeedback, can help individuals regain control over their bladder function and improve symptoms. Medications. In certain cases, medications may be prescribed to manage urinary incontinence. These may include anticholinergic drugs to relax bladder muscles or topical estrogen therapy for postmenopausal women. Medical devices. For individuals who do not respond to conservative approaches, medical devices such as urethral inserts, pessaries can provide temporary or long-term management of urinary incontinence. Surgical interventions. Surgery may be considered for cases where conservative measures have been ineffective. Procedures like sling surgery for stress incontinence or artificial urinary sphincter implantation for severe incontinence can provide significant improvement. Emotional and psychological support. Urinary incontinence can have a substantial impact on an individual's emotional well-being and quality of life. Support groups, counseling, and education about the condition can provide emotional support, coping strategies, and a sense of community for those affected. Conclusion. Urinary incontinence is a widespread condition that affects individuals of all ages, genders, and backgrounds. Understanding the types, causes, and management options for urinary incontinence is crucial in providing effective care and improving the quality of life for those affected. By implementing a comprehensive approach that encompasses lifestyle modifications, behavioral therapies, medications, medical devices, and, if necessary, surgical interventions, healthcare professionals can help individuals manage and overcome the challenges associated with urinary incontinence. Additionally, raising awareness about this condition, destigmatizing it, and promoting early diagnosis and intervention are essential steps in empowering individuals to seek appropriate care and support. Thanks for watching. Please subscribe to the channel.